So in this section, we're going to talk about good communication that should come from your provider, because whenever they are communicating their instruction in a clear way, it can increase your adherence to the payment regimen, to the treatment regimen. So basically, the instruction from your provider, it has to be more clear, jargon-free, and it has to be understandable. They have to just repeat their instructions. So this way you can just understand them better. And if you would have any question, you can just single out that unclear part and just ask for clarification. Another good way of communication between a provider and also patient gonna be using the written form as well. For example, whenever they're just talking to you, they can just give you a copy of their instruction, or you could just ask them for a copy. So when you got home, you can just check the copy and just make sure you just understood everything. If you would have like any sort of question, you can just call them or email them and just ask. So the key here is the instruction should be repeated on and more than once from your provider. Why they should just repeat themselves, why they should just clarify everything, because the quality of the communication gonna impact your treatment regimen. You're gonna practice that treatment regimen more and more. And in general, people who gonna enjoy the relationship between themselves and their provider, they're gonna stick to the plan more and more. But we all know that not all providers, they are familiar with how impactful a good communication can be. So they have to be taught about some sort of communication skills, and they have to just acquire that kind of communication skills with their patient. So there gonna be some training for providers as well as some training for patients, because patients also, they have to be understandable and they have to be very specific and concise, because like just poor provider, they're gonna just listen to probably 20 people in a day. So we have to just understand them. Training provider, training programs for provider is just basically simple supportive behavior that can help providers just be just having like more sympathy, just being more understandable, just trying to just do some eye contact. It's not just all about verbal communication skills. They have to follow specific non-verbal communication skills like gestures, eye contacts, at least like some nodding, shaking, or like something like that. Shaking head, But yeah, they should just follow verbal and non-verbal cues of communication. Same goes with patients. They have to just educate themselves. They have to just be literate about their own problems. They have to just know how to talk to their patient. There are like some, to their providers, sorry. There are like some dramatic patients. They would just go to the doctor. Either they are just very anxious, neurotic, or sometimes they are just crying in the middle of their explanation, or just talking about their symptoms, which is understandable, especially, for example, when you are suffering from a pain, and this pain is just going on and on without any sort of improvement. Of course, you're gonna cry or you're gonna be sad. It can happen to everyone out there. But just managing your emotion, just understanding that your doctor is just someone like yourself. They're gonna listen to so many people in a day. I have to be concise. I have to just explain my problem in a clear way. So this way you can just actually decrease that sort of narrative, negativity, stereotypes about like patients out there. Also, you can just get what you want from your provider. So just communication is important for every problem, I would say, but especially for like interacting and communicating with your provider as well. Here, actually, it's the good figure. Just talking about information, motivation, behavioral skills for health behavior. So here you can just see how information and motivation in health behavior can just interacting with each other. And both of them, they can just actually impact health behavior skills, which can lead to more healthy behavior. So if you would have this skill, you can have like more healthy behavior. This is very important. Try to just understand that. However, it's just very simple as well. But I would say it literally has the core idea of how like behavioral skill gonna go along with health behavior. A hospital setting is just very important. Hospital, they should be functional. In general, hospital has three main goals: cure, care, and core. Cure gonna be they're gonna perform treatment. Care, they're gonna do as much as possible to take care of patients, both emotional and physical states in balance, and core, ensuring that everything is just going smooth. The point here is it is very good if cure, care, and core get along together, but not necessarily we can have them all in a perfect way at the same time. I mean, sometimes one of them, like cure, gonna be the priority. Another time, for example, care gonna be the priority. For example, a mental health problem, core gonna be the priority because like maintaining the whole system and functionality gonna be even more important than care or cure. So the role for health psychologists is just very important because like majority of people either before or after surgery, they need some sort of preparation for pain control and or for just going through the surgery itself. So there should be some intervention that coming from health psychologists that could just help people. So again, these interventions could be before or after a procedure or even during like diagnosis stage. But the point here is health psychologists, they have to teach appropriate self-care techniques to the patients. So this way they can just actually tolerate all the pain and all the hardship in a good way. I mean, in a manageable way. Like you cannot ever just manage them in a good way. You can just manage them, right? Because like just being sick, having illness is very hard, it's very dramatic, both for you and your family. So the least you could do is just try to just understand some techniques and just apply them on yourself to just, be more prepared for what's going on with you. So many hospitals nowadays, they do have some sort of interventions and they're gonna just help patients to just be familiar with that kind of intervention, to just be more prepared for just what's going on next. This way, patients, they're gonna be less emotionally distressed. They're gonna actually, they can function more quickly, like they can recover better and they can leave hospital sooner.